This is Module 7 of the pre-work for the 2017 mid-year meeting presenting AllCom. So our objective for this module is to have you practice the information before you arrive at the meeting next week so that you'll be able to present and position AllCom with confidence in your workshop next Wednesday. So let's take a quick look at the agenda. We're going to go through a quick disclaimer. We're going to take a look at the AllCom conversation card. I'm going to walk you through the AllCom trifold detail piece, page by page, with some tips on presenting. And then we'll take a look at what's next. So let's get started. So I always like to start out with a disclaimer because what you may be doing at the meeting might be a little bit different, and this is our first dip, as we like to call it, using the new trifold detail piece with AllCom. So the more you present, the more you'll find your way and your own sense of style. You'll find your own comfort zone, your own vernacular, and it's going to be the way that you want to present the story. So be open and flexible, because the way I'm demonstrating and presenting today may not be the way you end up presenting. So this is our AllCom conversation card. For those of you that are new to Color Science, you've hopefully seen these in the pre-work on the Academy, and we have these with all of our new launches and new protocols. So this gives us the why, the profile. It gives you some power questions so you know how to start your conversation, and then some common objections you might come up against so you can start to work through those and answer those in your mind before you get in front of your accounts. So make sure you take some time and go back and really study the conversation card. So before I take you through the detail piece, I just want to set up a little scenario just so we kind of have a reference point as I'm walking you through it. And I'll be taking my presenting hat on and off just so I can give you some tips and then do some, role playing with you as well. So the scenario is you've just returned from the mid-year meeting. This appointment was scheduled before you left for the meeting, and your account is looking forward to hearing all about your new product, AllCom. This is a medical dermatology practice with the cosmetic side, and these are your attendees today. So you're waiting for them to come into the meeting. You've got your detail piece in front of you. This is the very first page. So you've got the picture of AllCom. We're introducing it. It tells it what it is. It's broad spectrum, SPF 50, neutralizes redness, soothe sensitive skin. Try to say that fast 5 times. So while you're waiting for them to convene, or they're coming in, they're like, oh my gosh, there it is, I'm so excited. I know, look, great, isn't the packaging beautiful? And you may be having a conversation with one or two as the other are coming in. It's really just, it's sitting there waiting to get started. So whether you go through a lot of detail on this first page, you'll find your way with that. But the one thing that I would like you to do before you get started is manage the expectation up front, is when you're actually going to bring out the product and let them touch it and experience the product. That's where we always want to go first, because we just want to get in there and show up and throw up and show them the product, because that's what we want to do. But we've got to find out some things first before we jump into the demonstration or to the S, if you're familiar and going back thinking about IASCA. So manage this expectation up front, and if you do that, it won't seem awkward. So it might sound something like this. So I want to thank all of you for your time today. I just got back from my meeting. We've been talking about this for a long time, so I'm really excited to share it with you today. But what I'm going to do is I'm going to take you through the information on the product first, and then we're going to have some fun. So when we're done going through all the information in the brochure, I'm going to bring out the product and we'll get to experience it firsthand. Does that sound like a plan? Okay. So when you first open the trifold, if you imagine it's all the way, it's just you've only opened the left side. So you've still got the right side closed, and that's where the before and after pictures are. Now, some of you might think that's going to be page 1, and that may be for you. I'm just going to show you the way that I would do it, and then again, you're going to find your way. So to me, this was page 1, because I want to start with the story first. So I've opened it up, and to my left is this page. In front of me is the before and afters, and I'm going to take a piece of paper and cover up the bottom like you're seeing right now. And then I'm also going to cover up the before and after picture. So I'm going to have that readily available, like I'm walking you through this right now because I'm teaching you how to do it. But you want to have those extra pieces of paper handy, or maybe it's even covered before you even open up the trifold. So you've already got that blank piece of paper in there before you even open up the trifold, so they can't even see the pictures and it's not awkward. That's what I would do. So this is where your story is going to begin, before you even show the bottom part, because you want to start setting them up and getting them to understand really about the inflammatory process of redness, and really what were we thinking when we came up with the innovation of Allcom. So set that stage. And the reason you want to cover it up or consider covering up, it's up to you, is you want to keep your audience focused. You know, I've been doing this for a long time, and I have found that if you don't do that, they're reading to themselves, they're already off on a tangent in their mind. Even though they might be sitting there shaking their head, they're already on to the next thing. So you want to keep them focused and keep the distractions minimal so they can really hear what you're saying. And it might sound something like this. So before we actually dive into the actual ingredients behind Allcom, because you're going to find how amazing this is, I just want to talk a little bit about the inflammatory process of redness, much like we talked about the pigmentation cascade when I brought in Even Up. So, you know, there's all those things that are happening beneath the skin before they show up as physical symptoms for your patients. And that's really where our thought process was when we were thinking about, you know, what's missing in the market, you know, what's needed, what's happening. And there's all kinds of things out there for all these chronic disease skin conditions that we're going to talk about in just a minute here. But I want to let you know that the process of the innovation behind Allcom is not only dealing with what we're seeing. So if you look to the right and see this red here, that's what's happening on the patient's skin, the redness, the burning, the stinging, the irritation. But I want you to know we were thinking before that, what's happening underneath? And as I go through the ingredients in just a bit, you're going to see how we really put a lot of thought into what we're doing beneath the skin so we can really calm and soothe those irritations that are showing up on top of the skin for your patients. So now what you've done is you've taken down that piece of paper, and now they can see the second part of this page. So again, it's a great story to be told, but you want to take it piece by piece because there's a lot of great information on this page, and you want them to kind of stay with you. So continuing the story, it might again sound like something like this. So, you know, when you consider the inflammatory process of redness and all those factors that lead up to the physical symptoms your patients experience, are these some of the same things that you're hearing your patients are struggling with? So looking over to the right, those physical symptoms, we talked about the redness, the itching, the stinging, the burning. What else are you hearing from your patients? Let them talk. What we want to hear them start talking about is the emotionality of these conditions. The redness that keeps people home, the redness that keeps their chin down. And if they don't bring it up, this is when you want to start to bring it up. So, you know, when you look at the three things here, the weakened skin barrier, the pro-inflammatory factors, that's where we were really thinking with the ingredients that we chose with great intention to help soothe underneath the skin so that the physical symptoms won't show up on the top of the skin. So we can help to manage and soothe those symptoms. So is there anything else that you can think of at this point when you think about the physicality of what's showing up for your patients? Again, if they're not talking, try to get them talking. Hopefully by now they're really well into the conversation. So as I take you through this information, I'm excited to start off by saying Allcom is going to address all these factors you see here. The weakened skin barrier, the pro-inflammatory factors that start to lead to, again, those physical symptoms. So what's showing up for the patient will be better managed with using Allcom as an adjunct therapy. And I think you're soon going to see, because I'm so excited to share all that I learned from the meeting, is that there's nothing else like this on the market. So with Allcom, there's a lot of skin conditions that have inflammatory processes that lead to redness. What we're focusing on here very specifically with Allcom is acne, adult acne, rosacea, sensitive skin, and post-procedure skin. Now you've uncovered the last part of this first of page 2. So you're opening up these redness facts. And so when you open that up, you don't need to start going bullet point by bullet point. That's a big fat yawn, totally boring. And P.S. by the way, I'm an adult learner and I already read all this. So engage them. So, when you look at these facts here that I'm showing you, are there any of these that really stand out to you when you consider what you're hearing from your patients? Again, and if they're not saying anything, the number one exposure for rosacea is, the number one trigger for rosacea is sun exposure. How are your patients doing with their compliance with their SPF? Get them engaged, start asking questions, get your critical thinking hat on. Don't be a line reader, don't be a page reader. Start asking some questions to help connect those dots in their brain. So here's a tip, get them engaged. Ask them to share a personal story, or is there a patient right now that comes to mind when you see these facts about redness? Make it about them. You may have a story, but let's wait to share that later. Let's make it about them. So thanks for sharing that, Mary. When you think of your patient's struggles with managing their redness and other physical symptoms, I know what I'm about to show you, these before and after pictures, are really going to speak to you. Now you can remove that piece of paper, because up until now these have been covered. Take a moment and pause and let them take a look at them. I know it's kind of hard to be a little quiet, but try to do it. And let them look over the pictures and get them talking. So, when you see pictures like this, do you have any patients right off the bat? You don't have to say their name, but just think in your mind, is there any patients that come to your mind right away that would really get excited to see the immediate neutralization of that redness that they're always challenged with? So right now we're just going to talk about the redness we're seeing, and the reason why is we haven't dove into the ingredients yet. So I don't want to go off on that tangent yet. Right now I'm just trying to show them the visual of neutralizing the redness. So keep it simple here. And then think about, what else might you ask? And make sure you bring those with you when you come to the workshops next Wednesday. And don't forget to mention Dr. Topper's quote here, and that she is one of our key opinion leaders. So now you've opened up the trifold, so you've turned the before and after pictures over, you've opened it all the way up, and in the middle is going to be this page. And this talks about how Allcom works, which we've kind of we addressed that a little bit earlier, but this is a nice reinforcement. Again, marketing's done a beautiful job of laying it out for you. Again, I don't want you to be a slide reader because they're already reading it, but you speak to it and present that same information in a different way. So again, there's more on this page, but I've blanked out the bottom because I want to keep them focused. So this is important here because this is where you're giving credibility to what you said prior, that there's nothing like this on the market. So dive a little bit deeper into the correct, the protect, and the address. And be vigilant about these words because we're not treating anything. So this is not treat. It's in the treatment category for color science, but this technically, we're not allowed to say treat. So we're addressing the symptoms that come along with these chronic skin conditions. So what I love, you guys, about this correct in this particular, and you're going to see it when we're done, I'm going to let you touch the product. It's a very different green. It's a subtle green. It's a green that's more neutralizing. This isn't just camouflaging. It's not like a bright lime green or Kermit the Frog green. This is really a green that's cutting through and neutralizing that redness. And you're really going to see, and if the pictures didn't tell you before, you're going to see when you actually put it on your skin. Protect. You already know color science. You know what we're about. I'm just so proud to continue to say that we're giving you a powerful SPF 50 UVA UVB broad spectrum, and most products can't get that high of a SPF in an all physical sunscreen. So there's no chemicals. So pretty amazing stuff here. And then address. And I'm going to go into some detail about our BioSolace complex, and that's where we've really put together 6 key ingredients to help calm and soothe that irritated skin, and that also help provide ongoing relief with the redness and all those other symptoms that are related to their sensitive skin. Pretty cool stuff. So now I want to walk you through the BioSolace complex, and I want to walk you through these ingredients. So to all of you listening to the module, we've already been through this. I'm not going to take your time up on this particular module to go through the ingredients again, but I do want you to come to the workshop with the mind that, yes, you definitely need to know what the ingredients are and what they do. So you definitely need to know the features, but I want you to focus on the benefits. And it might sound something like this. So as you all know, because you're very well familiar with Even Up, once again, we have chosen Vital ET as that bioavailable antioxidant, that antioxidant that works immediately on the skin, neutralizing free radicals. And what that really means to your patients is that calming and soothing relief from the inflammation, from the redness, calming the skin down. You've seen before that it helps with UV exposure, but it's really going to help with redness, and there's also some studies that are showing it may address some of the redness associated with bacteria with acne. So the calming, the soothing, the inflammation, that's what they're going to really love about having this ingredient in Allcom. And then you'll do the same thing moving on with the rest of the ingredients and why that's important. So what it means to them and what it means to their patients. So this is page 5. This will be to the right-hand side. When actually it's actually turned, so you've got the middle, you've got the right there, then you're actually turning it over, and that is when you're going to see the Allcom features. So actually it's to the right when the trifold is open. Let me back up. It's to the right when the trifold, it's so hard with not being in front of you, but I think you understand what I'm saying. So close your eyes and imagine the page we were just on is your middle page, and then this is to the right. Okay, so when I look at this page, for me, I don't see a need to actually cover up the bottom and then talk about the top. What I love what marketing did here is that they did great spacing here, very quick bullet points with some visual pictures, which make it very easy on the eye. And then also how to use is very simple. There's 4 steps. It's not a makeup lesson. It's very simple, so keep it simple. And when it comes to the features, let them look at the page, and while they're kind of looking at it, you might say something like, so we've been through the information, we're almost to the end. Are there any questions that you have before we, close this part up? Pause. Let them talk amongst themselves, engage in some conversation, they'll ask you some questions, that type of thing. And now you can ask a trial closing question. So now that I've taken you through Allcom, where do you see this fitting into your practice and your patient's home care regimen? So again, you don't need to read off the bullet points here. They've already done that. Take this conversation in this direction, start working towards the close, find out if this is going to be a solution to their problem. Now we're on the back cover. Turn it over. This is part of our finishing touch protocol. We talked about how to maybe serve this up with the previous module. We were going through the protocols, but now is your time to kind of get that validation if this is something they can see in their practice. So would you like to feel the product now? Yay! Everybody wants to feel it. Great. So now is the time you bring out the tester and let everybody put on Allcom. And everybody's getting excited, they're trying it, they're commenting, they're smelling, they're spreading it, they're, comparing hands, maybe someone's got redness, all kinds of fun's happening now. Now you have their buy-in. You present your proposal, your pull-through strategy, you place the order, you schedule your training, you set up your next appointment before you leave, and you follow up, follow up, follow up. So what's next? Keep dipping yourself. Practice, practice, practice. Go back through this module, talk to yourself, practice with a friend, phone a friend, but practice, practice, practice. And you will have the opportunity to practice and present in person next week at the workshop. I can't wait to see your style and learn from you. So I look forward to your feedback, and I look forward to seeing how you're going to present Allcom next week in the workshop. So this concludes our module. I know we can do it, and I look forward to seeing you next week.